Please join me in welcoming Sue Lorimer.
The NHS is funded by the taxpayer and provided by Parliament through the NHS vote. Funding is channelled through NHS England, which is, I suppose, a giant HMO, and that's responsible for shaping how healthcare services are purchased and overseeing the groups responsible for direct contracting with healthcare providers. Simon Stevens, the Chief Executive of NHS England, is no stranger to US healthcare, as until recently he headed up United Healthcare within the US. He's led the production of a 5-year strategy, the 5-year forward view. So if the NHS continues as it is now, we'll be incurring an annual deficit of $45 billion by 2020. This is not an acceptable strategy. So the 5-year forward view proposed a bargain. For an additional $12 billion growth in revenue funding over the next 5 years, the NHS would deliver $33 billion in productivity gains and savings. This was accepted by politicians in the run-up to the election and is now a firm commitment. But the service now has to deliver on its side of the bargain, and this means an efficiency gain of between 2 and 3% each year. To the average person in the street, that doesn't seem a lot. However, it will be a big challenge for our members. The 5-year forward view also sets out a number of priorities for the coming years, involving structural change and transformation of services. I know that in the US, through your Value Project, HFMA US is very much on the same page as we are. Providing better quality care for a lower cost and better patient outcomes has got to be the objective of healthcare in this next decade. In the UK, we're also looking closely at how social services can be provided with health in a more coordinated manner. The challenges that we face are similar to yours. Higher costs of care, increased expectation of consumers, and an ever-aging and increasing population. So the message for the NHS is more and more about collaboration, to improve public health and increase self-care, to treat people closer to their own homes in community settings, and to reduce the use of hospital care. Resources will have to be moved around the system between organisations, and that means that there will be winners and losers. My theme for the year has been Stronger Together, because I believe that we have to work together to deliver transformation, and in doing that, we'll have to set our organisational interests aside. I believe your chair's theme is Go Beyond. And we in the UK will have to work beyond our own organisational boundaries to change services in the wider interests of patients. This is difficult, but should be achievable in a single-payer system such as ours. So my year's been about supporting individuals to develop strong, robust relationships which will withstand the challenging discussions and debate that are needed to move the agenda forward. And I'm proud to say that my colleagues in the UK are dedicated and professional people who, supported by HFMA UK, are prepared to embrace the challenge.